He has a master's degree from York University and has focused on Ontario healthcare for more than 2 decades. He's tireless and a joy to work with, and we are lucky to have him today. Doug, over to you.
Thank you, Pam and Megan. That's very kind of you to say that. I think I wrote that, so anyway. Okay, so I'm going to talk about the Ontario. Well, let me go back and I'm going to share the screen first. That's probably a good way to start. Thank you, Megan and Pam, for getting that going. So on the Ontario fiscal situation, the economy, and healthcare. Unfortunately, I'm the bearer of bad news. I think we are in for a very difficult struggle in the years ahead, and just looking over the parapets, and that's I think a big focus of what I will be talking about today. So Ontario funding has fallen far behind other provinces. We're now at about 20% behind the rest of Canada. It was not always thus for many decades. We were actually very comparable to the rest of Canada since about 2003-04. That gap has developed. That was true for both hospital funding and for overall healthcare funding, although hospital underfunding accounts for about 69% of the gap. This has a whole series of effects: less money to spend on a standard hospital stay than any other province, fewer admissions, fewer hospital beds, few beds on an international basis. We do edge out Indonesia and India, but otherwise are at a very low level. We have extraordinarily high bed occupancy, 96.2%. We have fewer hospital employees as a percentage of the population, significantly more hospital employees in the rest of Canada. The average length of stay in hospital is less in Ontario than the rest of Canada. We have rising readmission rates that have been going on for over the whole post-Great Recession, 2008-09 period, and that has continued to rise. We also have 17.9% higher sepsis rate in Ontario hospitals than the Canadian average. We also have significantly lower long-term care staffing. Long-term care is also underfunded like hospitals compared to the rest of Canada. A very significant lower level of staffing. We've had a huge change in the nature of home care. The clients, as they're called, are much more distressed, need much more home care, intense home care services than they did before, and the less ill patients, our clients, are now not being treated through home care at all. They're just being removed. The result of this is that the distress among unpaid caregivers in their homes has just gone through the roof. We've really seen a huge increase in that. So, and then this year, the COVID-19 fiscal year for 2021, starting in April 1st, there has been a very large spending increase, not as great as needed, but there has been a very large budgeted spending increase planned. If actually implemented, it would be a whopping 14.4% increase, if implemented. That's the key thing there. But of that $19.9 billion increase in program spending, this is overall program spending, including other programs aside from healthcare, there is about $9.3 billion in program spending that has been yet to be allocated to actual programs. They've set up special funds, a very large contingency fund, and for example, the Health Sector Response Fund. A significant amount of this has not been allocated. It has to be allocated to an actual line item, and that has not happened, at least as of the Financial Accountability Office's report in September the 10th. So a significant amount of unallocated program spending, and there is the FAO's report on that. The healthcare budget is up, even without these special funds. It is up 6.6% over 2019-20 the actual healthcare spend. But there is, of course, more available through the special funds that have that are in many cases not yet allocated. As Natalie referred to, almost all of the extra spending that is going on in Ontario is due to the federal government payments, not through the largesse of the Ontario government. Huge amounts of spending going directly to various people to support support people through the shutdown. But there has also been $10.8 billion in provincial measures that the FAO, the Financial Accountability Office, has identified, and only $3.6 billion of that is from the provincial coffers and not from federal transfers. So federal playing a very, very large role. There was also an InEar Spending report by the Financial Accountability Office for the first quarter, that is April, May, and June of this fiscal year. And what it shows is that there's been a $4 billion or 11.9% higher than higher spend than in the first quarter of 2019, mostly through two sectors, almost entirely through two sectors: education and healthcare. However, the education issue is strictly an accounting issue that will be clawed back in the third quarter. So the increase that has come is almost entirely the $1.5 billion, or a 10.6% increase in the healthcare spend compared to the first quarter of 2019-20. Hardly surprising considering what was going on. Then there's another way of looking at this, is just the spend compared to what was actually proposed through the budget, well, not the budget, but the initial outline and then its revisions. And here we are actually spending below every sector, well, except for education, which I mentioned is a special situation, accounting situation, is spending less than what was actually budgeted, including healthcare, interestingly. Hospital operations, the spending over the first quarter was $5.33 billion, or 26.6% of the annual hospital operations revised spending plan. Long-term care was also went over its budgeted amount by about $161 million. Again, hardly surprising. Nevertheless, I'm of the opinion, at least, that overall funding increase will be significantly less than advertised. As noted, there's a lot of the special funds that have not been allocated. Setting aside the temporary increase in education spending, the PCs actually spent $1.6 billion less than they budgeted in the first quarter of 2020-21, according to the Financial Accountability Office. On an annualized basis, that would be $6.4 billion less than budget. And here is my opinion, at least, is that the underspend may become even larger as the government's appetite for dealing with COVID appears to be diminishing. So for the following three quarters, I at least am looking for further shortfalls from the budgeted increase. Nevertheless, healthcare has received a significant funding through the first quarter, a 10.6% increase, $1.5 billion. Again, it appears the appetite for spending appears to be diminishing as the year wears on. What has this resulted in? Skyrocketing deficit. FAO predicts $37.2 billion deficit this year. Government tax revenues fell $12.1 billion this year. This is almost it's more than a fourfold increase if we have a $37.2 billion deficit compared to the rather large deficit last year of $8.7 billion, the actual. Often governments overestimate the deficits. I think that is going to happen this time too, for the reasons I mentioned earlier, that I think they are going to underspend their budget. Nevertheless, it's very significant, whatever it will be. It may be, 30 billion, I don't know, but it will still be very large. The debt is skyrocketing as well. Huge increase in the debt, far above anything that happened. The levels of percentage of the GDP are far above anything that happened in the 91, 92, and 2008-9 recessions. There's a chart that goes over that, shows it heading up to new uncharted levels, 47.8. Here is the FAO's estimate of what has to be done to bring us back to balance. Assuming the government tries to bring us back to balance in 2025, they're looking at about $14.5 billion in extra money will have to be found, either through revenue increases or program cuts. Revenue increases or program cuts. That's about 8% of total program spending. I find it very unlikely that the current government is going to naturally gravitate towards increasing revenues. I think there is a huge possibility that they will lean towards program cuts, and this is where we begin to set up for the problem. On a proportionate basis, that would be about a $5 billion cut from healthcare if they applied that on a proportionate basis. So, you know, what's the history lesson here is that following the 2008-9 recession, we had almost a decade of austerity from the provincial government. In fact, we still have just recently imposed a sub-inflation wage cap imposed upon broader provincial public sector workers, and yet the economic decline during 8 and 9 is probably going to be less than what the economic decline that we will see through COVID. We may have a larger decline when all is said and done. Similar attacks and austerity followed the 80-81 recession, the 91-92 recession. The 91-92, which I worked through, led to about up until 98 before we got a turnaround in policy. Again, significantly less bad than what we're dealing with right now, it appears. How long are we going to be dealing with this problem? I suspect it will be a while. I'm not anticipating that because for a number of factors, it usually takes a while for a consensus to be built among our sort of ruling elites about imposing austerity. It took till about 2012 after the last recession before they imposed the 0% wage increase on broader public sector workers and began the harsh austerity that followed. Especially now that we've got this ideology that we're all in it together. There's a lot of sympathy for healthcare services. So there's a lot of knowledge about healthcare services and healthcare workers. I'm anticipating, and also the fact that we have an election coming up in June of 2022 at the latest. I'm anticipating there won't be a huge attack until sometime after that. Compounding all of this is that we have a long-term decline in growth. Here is the chart on a 20-year moving average for the most dynamic developed capitalist economy, and we can see that there is a long-term trend. Actually, this would take us back to the 50s. The trend is even sharper of decline in growth. Significant decline in growth over the years. A secular decline in growth, the growth rate. That is true for a lot of them. We've got forecasts from the banks. They generally don't see us, banks and the FAO generally do not see us having, not returning to actual growth from the recession until 2022. The FAO estimates that we'll have negative growth over this year and next of 2.2%. Governments estimates 1%. Banks and private sector forecasts estimate 1.4 negative percent. So we are in my view, an unprecedented situation. I'll just wrap up with this. We have declining long-term economic growth. We have increasing inequality in our society. We have a major fall in economic activity, probably about 5% behind the normal trend line before we're out of this. Will growth return to what even the declining levels that we saw? A very uncertain economic future. A lot of uncertainty about this. We face huge government debts and deficits. We are in trouble. Maybe not right now. We're in a bit of a bubble. We've had a bit better increase in funding than we've seen in recent years. Not as good as it needs to be, but not what. But we are, in my view, likely tracking into some very serious problems. Twofold response. I think we need to develop our response very sharply. We need to increase revenues in order that 14.5 billion doesn't come out of programs, public sector programs, especially healthcare. But we also, and perhaps more contentiously, I think we have to look at ways to increase growth. Capitalist growth has been a long-term secular decline and is failing. We have to look at other ways to encourage investment in our society and to grow our economy. Without that, I think we are in a very difficult situation as we try to take revenue from the wealthy and the rich, which is not an easy solution. I think we also, while we have to do that, we have to build that response so that they don't come at us with privatization and cuts. We also have to begin to map out a strategy for more public sector growth, more growth that we can control, investment that we can control through public sector decision making, and look at that. To my mind, at least, is the way forward. So I think I've used up my time and maybe a little more, so I shall just leave it there. Thank you very much.
Well, thank you, Doug, for your doom and gloom report, but there was valuable information that the reality that most of us know that we're in right now. Doug, there is a few questions in the chat. If you don't mind just checking it out and replying on the chat. As you know, we're pressed for time. The next speaker we have is Sheila Block. Sheila is a senior economist with the Ontario Office of Canadian Centre for Policy Alternatives. Welcome, Sheila, and over to you.
Thanks so much. I'm really happy to be with you, and I'm just trying to find the right, here we go. I'm sharing my screen, and so even though Doug and I actually didn't have an opportunity to kind of plan our presentations ahead of time, they're going to fit together, I think, very nicely. And I think Doug really gave us the context of where health spending was at when we came into this pandemic. And I think, you know, the clearest message that I take from that really comprehensive information he gave us is that we entered into this pandemic without the surge capacity that we needed in the healthcare system that everybody spoke about needing for just this kind of emergency. And I focused in a little more narrowly when I was thinking about what I wanted to talk to you about today. And what I focused in on is the fact that we know throughout this pandemic, Doug Ford has really talked a good line. He talked about protecting Ontarians, he talked about protecting our healthcare system, and about how much he valued healthcare workers. But we saw also throughout the pandemic that his government has made policy choices that instead put the risk of the health of Ontarians and healthcare workers at risk. And that his policies that he actually implemented, as opposed to his words, particularly in long-term care, put the bottom line of for-profit providers first. So, you know, when I was thinking about what to speak with you about, I thought, okay, I'm going to take a look at the data and see whether it could shed some light on this disconnect between his words and his actions. And I thought what it might be helpful to do is compare the response of the three largest provinces, Ontario, BC, and Quebec. And there are some kind of similarities and differences between the three of them. And what I looked at first was increase in healthcare spending in the first quarter. So that's the increase in April, May, and June of this year when we were first entering into it. And I actually found the results kind of shocking, and so shocking that I kind of kept on double checking my arithmetic, which wasn't complicated, and double checking my data sources, because what you can see from this chart is the increase in health spending in the other two provinces was between 2 and 2.5 times the increase in Ontario. So what's really clear is despite all the fine words, this government just did not step up. And, you know, as Doug really kind of brought home to us, it's not because Ontario's healthcare system was well positioned to meet this crisis. And so just in the year before, we see that Ontario had the second lowest per capita health spending of any province. And in those years, Doug really kind of clarified for us how we had these kind of intermittent periods of austerity. So governments would come in, they would, you know, do harm to healthcare workers, to the healthcare system, and probably to patients and clients. Then they would realize that, you know, that this was actually having negative impacts, and we'd have a period where there was a little bit more health spending, and then you would see it pull back again. So this is the context of the last 3 months, the context of where we're coming in. But I think what I found really most chilling is when we look at how the Ontario government has comparatively prepared for the second wave as compared to the other two governments. And it falls very short of these two governments that had very different kind of positions in the first wave of the pandemic from each other. And so the BC response, particularly in long-term care, was really an example for the rest of the country. It had a timely response, and I think there's some healthcare workers on this call, and you all know far more than me that timing in this kind of a situation is crucial. So being 4 weeks ahead just had a huge impact in terms of kind of controlling the infection. And what BC did is it protected both residents in long-term care and rates. And some of the things that the BC government did was they made all long-term care staff full-time, and they increased wage rates. And at the beginning of September, the BC government went further and announced plans to hire an additional 7,000 workers in long-term care and assisted living. Quebec, on the other hand, in the first wave of this pandemic, had the same kind of horrific and heartbreaking outcomes in long-term care. But in June of this year, Quebec announced a program to train and hire 10,000 workers in long-term care, the equivalent of personal support workers. They call them, I think, orderlies in Quebec. And they also went further, and having analyzed what the weaknesses of the response was in the first wave, the province is requiring that every facility have one person dedicated to pandemic response, and that those people have close ties to infection control specialists. So this is kind of the response from BC, the response from Quebec. And what we see from Ontario is that the government announced $540 million in support for long-term care homes at the end of September. So, you know, just a few weeks ago. And these funds will be spread across staffing, the provision of PPE, infection control measures, minor capital repairs, and also something that is kind of revenue replacement, referred to as revenue replacement, because of reduced revenues due to requirements around the number of residents in each room. So that $540 million across all this is only a 13% increase in this hugely under-resourced sector. And as an example, that amount of money is only 30% of what we estimated it would cost to cover adequate funding and adequate numbers of hours of care for residents in long-term care. Needless to say, you know, this increased funding was not accompanied by a mandate or a requirement about staffing levels. And I think that, you know, we are so urgently need this government to treat the situation in long-term care like the emergency that it actually is, and to fund 4 hours of care and properly pay staff. And its own commission just yesterday, which its own commission of inquiry in long-term care, said that this had to happen and it had to happen urgently. So I think I'll leave you with that, and maybe we can move on to questions and discussion now, if that's okay with the chair.
Yes, that is perfectly fine with myself. Doug was answering some of his questions in the box. I was directing the speakers into the chat. If you can check out the questions and you want to go live with it, feel free to do so. Doug, did you want to verbalize your answers so everyone can hear? Because some people may not have access to the chat.
Well, unfortunately, there are better questions than answers that I have. A few people did ask about the Canada Health Transfer, which I did not talk about. That is a transfer of federal government monies, money to the province to pay for healthcare, and people are absolutely right. The funding that the feds have agreed upon are inadequate. It was the one rare time when Doug Ford and some of the other provinces came out and demanded a very big increase that I actually agreed with something Doug Ford said. That was completely ignored by the feds, and that was very sad. And I think we are going to have to take up that campaign again to get significant federal funding for healthcare. They do have a bit better access to funding. That said, the other problem is that the feds themselves, from what I understand, have played an extraordinarily large role in the funding for COVID, and their debt and deficit levels are very significant as well. So, but yes, we do have to pursue in a variety of different ways in improving revenue to deal with the situation that we have, and that includes federal funding. It also includes taxing the corporations and the wealthy, and we also, as I mentioned before, we do have to think of ways to change the long-term decline in growth in our economies. The forecasts that I see, even from mainstream economists ahead, are not for growth to continue to slow down. That will lead us in a significant crisis. We do need different options for ways to grow our economy. The typical capitalist methods for growing our economy have become more and more problematic, and I think that is going to bedevil us in the years and decades ahead.
Thank you, Doug. Sheila, if I turn it over to you, I'm just going down the chat here, and some of the participants are saying they couldn't see some or all of your slides. So if you can just kind of summarize what's been going on so that people can actually pick up from there.
Sure. So am I muted? No. Okay. Sure. So I just had two slides, one of which showed that Ontario's health spending grew by about 10% over the first quarter of this year, whereas BC's spending increased by about 26% and Quebec spending increased by 21%. And so I think, you know, in some ways we're in such unprecedented times that it's hard for us sometimes to kind of measure what's adequate. But I think when we look at these comparators, it clearly shows how inadequate Ontario's spending is. And I think agree a little bit and disagree a bit with Doug. I think that we have had some real openings here through this pandemic and through this tragedy. And some of the openings that we've had is, I think, you know, people in Canada have really realized that there's a benefit to public services and that we really need governments to step up at this time. And so I think there is an opening for what Doug's calling for, which is really a larger share of the public sector in our economy and in economic activity, and moving more of that activity, a share of that activity out of the public sector, out of the private sector and into the private sector. I also think we've had a shift, and a real shift in our understanding about debt and deficits. And I think what we really need to understand now is that the federal government has a lot of capacity to take on more debt. The Bank of Canada has a role that it has been playing, and even kind of mainstream economic thinking about problems with debt and deficits has really shifted. And so I do believe that we have this kind of room, and we have this opportunity that we haven't had for a long time, and through all this tragedy, to actually look at and see, you know, how do we value, you know, the work of caregiving, the work of caregivers? How do we actually expand and revalue that work? So I think I'm a little more optimistic. And I do think absolutely we need to increase revenues for a couple of reasons. I think the first is for that redistributional reason and to reduce inequality. And the second reason, I think, is yes, over the longer term, we do need to increase those revenues. But I think in the immediacy, with all the uncertainty and all those reductions in economic growth that Doug has been describing, we need to put in place those measures, but we shouldn't be acting on them yet.
I just want to thank you both for your presentation. It's been very informative, and the stats and the numbers that you were able to collect over this time frame, hearing it and seeing it, it is just time that we hold the government to task. And I just, before I pass it over to Megan, just want to say, as a healthcare worker for the last 33 years, work in the hospital sector, just when you think you can't see it, any more devastating things that happened, COVID-19 hit us. And I want to just say out there to the healthcare workers and all the other frontline workers in different industries that please find your voice. Don't be afraid to speak up, because when you are advocating for your health and safety and for your patient, residents, your coworkers, even though the employer are, I'll say the word, stupid enough to challenge you, speak up and draw on the resources that you have out there, and stick together. And we're in tough times. And I've seen it as a frontline worker in the emerge department. Even though we don't have the tools to work with, my coworkers are amazing. They give 100%. Even some days when we just feel like quitting, we just pull through because we're there for our patient, resident, and for each other, and just draw on that, and we will help each other. And thank you very much for your hard work out there. And you think people are not watching, but we're looking out for each other. And thank you, thank you, thank you. Over to you, Megan.
Thank you, Pam. We are actually a little bit ahead of schedule, so if anyone has any other questions they want answered, I think we have time for one or two more. I'm just going through the chat very slowly.
There's a lot of questions.
And comments. Great comments.
A lot of good comments in here.
Yeah.
Yes.
I just on Sheila's point, it was quite almost amusing to see the almost instantaneous change in ideology that occurred in March, where our ruling circles went from, oh heavens, deficit and debt, what a problem, to an almost immediate change to you know, money, no problem, we're going to start spending. And they did spend, even if inadequately. But that said, I am still, I think there is going to be a growing consensus in the period ahead that will turn, as it did after the 81-82 recession, the 91-92 recession, and the 2008-2009 recession, towards making working people and public services pay, including healthcare. And I'm expecting that to hit us very hard, but I guess time will tell.
So I see in the chat that someone's asking about what kinds of revenue sources would we suggest. And I think really we need to start our emphasis on reducing inequality. And I think that really calls for our most powerful tools to do that. And what we have is the personal income tax system is very powerful in doing that. It can't raise huge amounts of revenue in terms of looking to decrease inequality, but it can definitely increase fairness that way. And I think we're having a new and very important kind of conversation about a wealth tax in Canada again. We don't have one currently. And I think one of the big pieces that we found out from this pandemic is that, there are huge gaping holes in our social safety net. And we've seen how government has actually been able to move very quickly and effectively at closing some of those holes. And the CERB, the Canada Emergency Response Benefit, is an example of how governments can step in and provide those kinds of supports to people who need them. And really, we've been talking about those kinds of things for the last 30 years, and there's been little tiny tinkering around the edges, but we've really seen how governments can move quickly and important and in an effective way to support people. But what we have also seen is, in terms of the labor market, what we're seeing is high wage workers have been very protected during this pandemic, and we're actually seeing an increase in employment for those with higher wage workers. Whereas low wage workers, particularly those who have worked in hospitality, in retail, in other areas, have not seen their jobs or their hours come back. And so what we really are seeing, both in terms of employment and income, but also in terms of what's happening to wealth, is that wealthy individuals continue to accumulate more through this pandemic, while low income folks have not. And that clearly points again to the need for really powerful and effective policies to reduce inequality in this country.
Thank you, Sheila. There's another question there. It says, how can we capture this conversation to reframe it in terms that will communicate very clearly and very broadly, and turn the public perception from nickel and dime to supporting public institution? Either one, you or Doug can chime in.
People are asking hard questions. I prefer to answer the easy ones.
Yeah. I think I think that is the question for us now, right? Is how do we move? And I think part of that is we've really seen the cost of just nickel and diming things, right? In terms of, we have an EI system that could not support people when they lost their jobs. We had a long-term care system that miserably failed people. And so I think that object lesson means that we really need to move quickly as progressive people before everybody forgets about this, and actually move and get positive policies happening. I saw one thing when in the spring where we really expanded our idea of essential workers and expanded it to those low-wage private sector workers who were working in grocery stores or in drug stores. And somebody was talking about the need to address that probably in June or something, and the response was, "Oh, that's such an April conversation." So I think things have been moving very quickly in this pandemic, but I think what we are continuing to see as people face the ongoing kind of health and economic insecurity, that there is the appetite for the kinds of changes that we've been talking about for the last 30 years. And I think we do have this opportunity in the midst of all this tragedy.
We have seen a huge growth in the understanding of both healthcare and some of the healthcare worker issues that we've seen. We've seen, you know, the move towards treating long-term care workers with better pay, which has been a long-standing problem. But we've also got a much greater understanding of the importance of healthcare under this, and especially long-term care. I think there are significant openings there around public delivery of long-term care that we haven't seen for many years, as long as I've been involved, for 28 years in healthcare, and also for increasing the staffing levels. The fact that we have yesterday the long-term care commission led by the guy who defended the government during the Walkerton crisis, come out and recommend 4 hours of hands-on care is a significant change in what's going on, and would be a significant improvement for the people the residents in long-term care. That said, I do think there is significant power among ruling circles that will reshape the debate that has gone on as we move past the COVID crisis, hopefully in the next year, and that I think we do need to prepare for. That is going to be a significant attack on our public services, and including our healthcare services. Ideologies, as we saw in March, can change very quickly when they're backed by the most powerful forces in our society, but they can change again, and that I think because there will be such resistance from corporations and the wealthy to spending the way they have, and to providing the supports that they have during this crisis, that we can anticipate a very significant backlash, and that is what I fear, and what I would urge us to prepare to build, especially with the significant potential now that Doug Ford will be reelected, with the false credibility that he has gained. In my view, false credibility. I know we have.
Sorry, Doug.
Sorry?
I'm going to have to ask you to wrap up soon.
Okay, sorry. I'll just end it there. Sorry.
No worries. Pam, do you have any closing remarks?
I think I did mine earlier. All I want to say is thank you to all the participants for giving your day on the weekend to participate. And thank you all very much for all the speakers that did their presentation. Thank you.